Dr. Don Colbert, the keto doctor. And I mean the keto doctor because he introduced it. And I'm glad you're here because I want to talk about that. Because, Doc, there's a lot of questions now about the keto diet, all that.
Right.
And I'm highly interested in knowing more about it because I want to know for my own self, why is it so important and what is it that is so good about it?
Well, first of all,
But I'm glad you're here and Mary right here on the side. I love it.
Well, I wrote a book a few years back called Beyond Keto, which is a healthy keto diet. Now, the keto diet is simply a high-fat, very low-carbohydrate diet. And most keto diets, unfortunately, are unhealthy because they cause you to eat a lot of red meat, a lot of butter, a lot of bad oils, and they don't give enough fiber or enough vegetables or enough omega-3 fats. So what I've done is I've developed a Beyond Keto or keto zone diet. You're in the keto zone where your body shifts to burn fat from burning sugar. You become a fat-burning person when you get into the keto zone. And I do this by using more of God's foods and less of man-made foods, less of the foods that create inflammation in the body. And those foods are primarily like excessive amounts of red meat and cheese and things such as this, more vegetables, more healthy oils like olive oil. Olive oil, I call it the king of oils. But there's different types of olive oils now, like high polyphenol, high phenolic olive oil. These are amazing oils that have this powerful phytonutrient in it called oleocanthal and other polyphenols that actually help your circulation. They help rid the body of plaque. They help prevent plaque. They help to improve blood flow throughout your entire body, your brain, your carotid, your coronary arteries, and all your peripheral vasculature.
So let's just go to the beginning. Someone who needs to get healthy.
Well, first of all, realize in the U.S., about over 40% of the people in this country are obese. 40%, over 40%. And you know that now we have about almost 50% of Americans are either pre-diabetic or diabetic, almost 50%.
That's shocking.
So we have an epidemic of diseases, especially heart disease. When you choose to have diabetes and pre-diabetes, you just bumped up your risk of most every disease, especially heart disease.
So how do we reverse all that?
Well,
how do we start?
Well, we start by doing a healthy keto zone diet or my Beyond Keto diet.
Okay, but what do we do
What
to
we
begin?
do? Well, again, first of all, I like to tell my patients when they eat breakfast, we used to teach people to eat breakfast like a king, lunch like a prince, dinner like a pauper. Now, due to the benefits of intermittent fasting, a lot of my patients are skipping breakfast and having tea or a cup of coffee.
Explain that.
Well, intermittent fasting is where you go without food for about 14 to 16 hours or longer. And when you do, after 12 hours, your body unleashes the most powerful process called autophagy.
So that's good to do.
It's real good to do because when this happens, your body starts to digest old abnormal cells are eliminated from the body, abnormal proteins. Your body gets rid of cellular garbage.
So you need to start with fasting.
Right, fasting in the morning, fast breakfast, and maybe
Okay.
have a cup of tea with your stevia or lohan or monk fruit in it, or a cup of coffee. I'll have a cup of coffee.
I heard that stevia is bad. Is that true or not?
Well, no, stevia is fine. It's the erythritol that is bad because it can cause plaque.
So fasting.
Fasting, have a cup of tea or a cup of coffee with stevia or lohan or or monk fruit in it. And then what you want to do is have a healthy lunch and a healthy dinner. Now for lunch, lots of veggies. Think of a salad, think of chicken, and also use olive oil. Now, when you get in the keto zone, what's really hard for people to understand is to get in the keto zone, you have to put fuel in, fat fuel. About 80%, 70 to 80% of your diet will be healthy fats, mainly in the form of avocado oil or olive oil or healthy nut oils or nuts.
What are, besides olive oil, what are the healthiest oils?
Well, again, there's macadamia nut oil, there's almond oil, there's avocado oil. Avocado oil has one of the highest smoke points. It's great to cook with. So if you're going to cook with avocado oil.
But it's hard to find organic avocado oil. I
Yeah,
tried.
you can get cold pressed avocado oil, and you can get again all the different nut oils. You can get those and almond oil,
Organic,
and those
I
are
mean.
good. Yes, you can find those.
Okay.
You can.
But it's harder in some
It
stores
is.
finding
Yes, you
the
have to go to
organic
Whole
avocado.
Foods or
Right.
Sprouts or a place like
But
that.
now,
Right.
go back and talk about the healthiest olive oil, because I love
Right.
olive oil. What's the
Well,
healthiest?
the healthiest are the high polyphenol olive oils.
How do you know that?
Well-
How would you, like
Well-
someone like me, how would I know it's
Well,
the
now they have a new classification on olive oils, and in Greece they have the gold medal of olive oils each year. So they actually choose the ones that are the top olive oils that are high polyphenol. See, there's a new class. There
Does
used
it
to
say
be
that word on
Oh
the
yes,
bottle?
it will.
Okay.
It'll say high polyphenol or high phenolic. There used to just be extra virgin and virgin olive
Because
oil.
I thought you told me once, if it burns
Yes,
when
and
you drink it,
yes,
then it's
that's
a
the
good
key.
one. And if it
That's
doesn't
the
burn, it's
key.
not a good one.
Yes, but now what happens? Is yes, it can still burn, but it still may not have the high enough oleocanthols and polyphenols and phenolic compounds that you need. The higher, the better. When you get a good high polyphenol olive oil, you will have usually a burn in the back of your throat and a slight cough. You'll hack. That burn is good. It's called the ibuprofen or Motrin effect. When someone takes liquid Motrin or ibuprofen, which is a pain reliever, it stimulates these receptors in the back of your throat. Olive oil does the same thing, and it causes burning and a hacky cough. That's all. But it shows that is a better olive oil. Most olive oils, you will not have that effect.
Okay.
Because most olive oils are low polyphenol or moderate. But when you get a lot of these Greek olive oils are high polyphenol, it just so happens the earlier harvested olives have higher amounts of oleocanthal, but you can't get as much olive oil.
Why
out.
Greek? Why could it not be
No,
like
you can-
Italian or Spanish? Or
Well,
from
again, it's
Spain?
where the soil's grown, how much moisture is there, and again, the time of year. It's a lot of factors that factor in.
Okay.
But you can in other countries too. You can get high polyphenol olive oils in other countries. It just so happens to be a high polyphenol olive oil. You have to have so many parts per million of polyphenols or phenolic compounds.
So you start with a nice salad.
Yes.
Use those good
Right.
oils.
Lots of veggies in your salad. See, most keto diets don't have hardly any veggies. They have hardly any fiber. So you want a lot of healthy veggies in there. You want colorful vegetables in there. Lots of salads. You can have cucumbers. You can have onions, some tomatoes, some carrots, things like that. And then lots of olive oil. Now you say, well, what about other salad dressings? Most salad dressings, you know what the oil is in salad dressing?
No, tell me.
Soybean oil. Soybean oil is very inflammatory to the body. It invites inflammation in the body.
And that's what you find in most.
Yes, or canola. Canola is even worse for most people. It's a genetically modified oil. But these oils, for most salad dressings come in, are highly inflammatory and usually contain soybean oil. So we want to shift people over to the olive oil. Even better is the high polyphenol or phenolic olive oils, or even oleocanthal olive oil. So those are the best. And if you can't use olive oils, you can use avocado oils or macadamia nut oils.
Now I like mixing my olive oil with balsamic vinegar.
Right, you can
That's
do
good.
that. Yes, vinegar's fine.
Because
sure.
it gives it a little
it gives it a
taste.
better flavor. Sure,
Yeah,
and
maybe
you can do
just
that.
some herbs in there,
And that's
stuff
good.
like
Put all
that.
the herbs and the garlic and all the different.
like garlic powder.
Sure,
and
that's great.
Garlic salt.
Yeah, all those herbs are good for
onions.
you, and those are anti-inflammatory too. So they're great for you. And then you have your protein too. You want some protein. Now you don't have to have a whole lot of protein because your body's burning fat as fuel, and you won't be hungry for like 8 hours usually if you do this right. Well, you need a man needs about 4 to 5 tablespoons of olive oil per meal if they have 1 or 2 meals a day, or even more. They can have up to 7 tablespoons. So a lot of times at lunch when I'm having mine, I have a big old bottle of olive oil, high polyphenol. I just pour it all over my salad. I just keep pouring, and Mary will look at me, "Are you sure you're going to have that much oil?" I said, "Yes, I need this much oil. This is what my body runs on." When you're in the keto zone or you're burning fat as your fuel, the benefits are amazing. It turns your brain on. Your brain runs best with fat as fuel, but not bad inflammatory fats like cheese and butter and cream, but healthy fats. Also, what happens, your energy increases. You have more stamina, more energy, more vitality, your hormones seem to work better, your neurotransmitters seem to work better, and the key thing, you're burning fat as fuel.
Let's go to dinner. So
Sure.
what would you recommend?
Well, again, it's similar to lunch. You want a lot of fats, and so you're going to be using your olive oil again. And so you have your veggies, and so you just pour, if you're having two meals a day, you pour about 5 to 7 tablespoons of olive oil on your food or on your salad. It's good to have a salad, lots of olive oil, then put your olive oil on your veggies. I put my olive oil all over my veggies,
And
too.
what kind of protein?
Again, you can have chicken, fish, turkey, and again, or you can have a little grass-fed, meat if you want at times. So that's fine, just not all the time, just maybe twice a week. And then I tell people every day, if you're on the keto diet, you want extra fiber. And so you can have psyllium husk fiber. We have a wonderful product called Fiber Zone that has a wonderful lemon lime flavor and another one that's berry. And so you do this, and it keeps your bowels working normally. A lot of people on the keto diet, they don't take enough fiber. And that's one of the key things. And the other thing that people on the keto diet are lacking are omega-3 fats from fish oil. So we have everyone take a 500 milligram fish oil capsule each day. And then you're getting the perfect fuel mixture that your body needs to burn fat. So you're getting your veggies. You don't have to have, we don't have to have carbohydrates, sugars, and starches to live on. You say, what about fruits? Just a small amount of fruit, maybe a quarter cup of berries. That's it, or lemons and limes with it. You say, what about other fruits? Too much sugar this is when you're losing weight. Now, once you've lost weight, we shift people from the healthy keto zone diet or Beyond Keto to the healthy Mediterranean diet. Like for me now, I shift in and out of keto and Mediterranean. The Mediterranean is like the keto, but we add healthy carbohydrates and starches and beans.
But how long does it take for the average person to stay on the
until they lose weight,
keto?
Until they get their weight down to a healthy weight, a BMI of around 25 or a little less, 20 to 25. Once they get their body mass index 20 to 25, usually at 25, they can shift over to the Mediterranean diet.
Now, let's talk about that.
Yeah.
I mean, I grew up eating that kind of diet.
That's probably the healthiest diet in the world, but if you're going to lose weight, it's harder to lose weight on the Mediterranean diet because you're burning sugar as fuel. But still, it's a very healthy diet. So once you get your weight down to about 25 BMI or less, you can shift over to the Mediterranean
But
diet.
now with that diet from the Mediterranean area, like we used to, and I still eat myself, I like to have eggs.
Yeah, that's good.
I like to have feta cheese.
And that's
I like
good.
to have
I do the
olives
same thing. That's what I do. Sure.
Cucumbers and
Absolutely.
stuff like that.
Those are great. That's Mediterranean.
But you said earlier cheese. I guess you meant regular cheese.
Yeah, not regular cheese. Regular cheese is inflammatory. You know, the two most inflammatory foods I see in my practice, I've been practicing over 40 years, and number one would have to be wheat, and number two is dairy. They call
wheat,
wheat.
Like
Wheat bread, white bread, yes.
Okay.
Bread,
White
pasta,
bread.
yes. They cause more food reactions. More people react to those two foods than most any other food. Now, feta cheese is different. Feta cheese does not have the casein A1 in it. Casein A1 creates inflammation and mucus in the body. Casein A2, or feta cheese or goat cheese, doesn't.
But Mediterranean diet, we do have bread with it too. I mean, I grew up eating the healthier bread.
Right, healthier bread's okay in moderation. Again, most of the bread here in the U.S. is not that healthy. We spray Roundup on it or glyphosate on it, which is a weed killer. And so the bread is not as healthy. In Europe, the breads are much healthier than we have here. But you can have some wheat in moderation and you're fine. It's okay.
I like to actually cook my own bread.
That's fine. And you can do that. But again, here in the U.S., most of our wheat is highly inflammatory. See, we use the dwarf wheat. And the dwarf wheat has 23,578 different proteins, any of one of which can cause inflammation in the body.
Repeat that again.
Well, it's just what happens is our wheat has lots of proteins in it that can actually create inflammation in our bodies. And so I see, again, as a doctor, I've seen patients for many decades and many people that eat excessive wheat, especially the wheat that, the white bread they eat here, the white pasta, they have a lot of gut issues. And many of them develop wheat sensitivity.
Doc, now meats. So what are the healthiest meat for the Mediterranean diet? I mean, you said like red meat. Now, I don't eat red meat at all.
Well, that's the best if you don't. Red meat and pork and the worst meats. First of all, the worst meats are processed meats: bacon, sausage, all those highly processed meats that a lot of people eat. The meats that are good on occasion, maybe twice a week, is red meat, like a burger or a steak, but choose grass-fed. The meats that are best are chicken, turkey, fatty fish that are wild fish. The best kind of chicken would be the white meat. You say, why? Because most of the animal's toxins are excreted or in the fat of the animal. That's why cheese has a lot of fat in it, and cheese has a lot of the dioxins.
So you said
PCB.
the white meat in a chicken.
The white meat in chicken, so the breast of the
is
chicken.
healthier.
Yes, than the dark meat.
Dark meat,
Yeah.
because
Now,
there's blood in the
because
dark meat.
because the dark meat, the animals store a lot of their toxins in their fat.
I
and
had never
people don't
heard you
know
say
that.
that.
Yes.
That's very
And most
important.
people don't realize that, but an animal, they literally push a lot of the toxins into the fatty tissue. So the
Wow.
more animal fat you eat, generally the more toxins you're getting in your body. And so I don't eat a lot of animal fat. I try and minimize that. I use a lot of olive oil, but if I ever do get a steak or something, I'll immediately have a heaping scoop of my fiber zone. And that fiber zone binds the toxins and the bad fats and escorts it out of the body.
Can I go back to the breakfast? Now, some
Sure.
people
Yeah.
like to have cereal.
Yes.
And things
Oatmeal.
like that.
Mediterranean is
Oatmeal.
fine. If you're at 25 BMI or less, you can have oatmeal. That's fine. In your oatmeal, you can put berries.
Daily or sometimes?
Yeah, you can have it every day if you want. Oatmeal's still fine if your weight's fine. If your weight's heavy, if you eat oatmeal
But how
and
about
cereal,
the
you'll
sugars
gain
in
weight.
it, though?
Well, you don't put sugar in oatmeal.
No, I mean, but isn't there some sugar because it is?
Well, it's
some kind of-
it's got some carbohydrates in it,
Right.
but it's got a lot of fiber in it too. But it depends. If you have a
Well,
huge
it
bowl
turns
of oatmeal.
to sugar is what I meant. Right?
Well, it can, yes. But again, if moderation is okay. If you have a small bowl of oatmeal with berries and with fiber in it, you're going to be fine generally.
Now,
And that's
some
not a
people
problem.
I know some people that like taking the powder in the morning,
protein
a
drink?
meal replacement
Yeah, and you can do
powder
that.
stuff.
Right, as long as it's a healthy meal replacement, see. And again,
What is the best?
well, it depends. Some people are sensitive to whey. Some people are sensitive to eggs. Some people are sensitive to, pea protein
Okay.
and quinoa and other kinds of protein. So whatever agrees with you. And I take the egg white protein is what I take. And so that protein agrees. And I don't do it every day. I may do it once or twice a week. But if I'm in a hurry, I can take egg white protein. And I can put my avocado oil in it, and I can make it keto, see? And I can put some berries in there too, or I can put some my vanilla collagen in there, which is great. So collagen is another real good protein that tastes
A lot of
good.
people eat out in restaurants.
Right.
How do they control that?
Well, you've got to be careful when you eat out, because when you eat out, what I do is I get the salad, and I'll bring my own olive oil or use theirs.
yeah, but it's not organic often in those restaurants.
No, it's not. And again, that's why
But isn't that bad for you?
Yes, it's not good, but again, a lot of people just don't have time and they have to eat out. So you can do that. And what I do is I'll bring my olive oil, because if olive oil is in a tin can, like a lot of these restaurants get their olive oil in these big tin cans and they pour it in there. When it's in a tin can, it's going to have bisphenol A in it. That's an estrogenizing agent that causes your estrogen levels to go high. And so that's why I bring my own in a glass bottle, because then I don't have to worry about bisphenol A going up and estrogen going up.
I want to ask you two important questions that I think people really need to understand a little more. We've talked about this before. How do you reverse heart disease?
That's
number one.
Number one, you've got to be on a healthy diet. And the healthy diet, I tell most of my patients with heart disease are diabetic, pre-diabetic, the healthy keto diet or the healthy Mediterranean diet. That's the first thing. Number two, olive oil. They have to take a step up on the olive oil, not extra virgin, high polyphenol and oleocanthal olive oils. The oleocanthal olive oil literally eats the plaque out of the arteries. The other thing that's critical in reversing heart disease, and that's plaque in the arteries, is something very strange happens to every person, man and woman, after 50 years of age. The body starts to form calcified plaque in all the arteries of the body, and you start to decalcify the bones. That happens to everyone. The Japanese eat a staple dish called natto, which is fermented soybeans. These fermented soybeans, so many of the Japanese eat it, but they don't have near the heart disease we have here because the fermented soybean or natto has a vitamin in it called vitamin K2 that pulls the calcium out of the arteries. And so what I do every day, I take vitamin K2, 200 micrograms twice a day, morning and evening. And we have our own. But it's one of the most important things. That olive oil, the Beyond Keto diet or the Mediterranean diet, the super vitamin K2, and then a few other things. Fish oil. You need to have fish oil if you're going to reverse heart disease. Now, some people need a little, some people need a lot.
But don't we get that by eating fish, though?
Yeah, now if you eat fish, you don't have to take fish oil, but most people don't eat fish. And most people eat the wrong fish that's not high in the omega-3s.
Let's say we do eat fish. How often a week?
Well, again, I would, on the days you eat fish, you don't need the fish oil. If you're eating wild salmon, that's good. If you're eating sardines, that's good. But most sardines come in a can, so you're getting a lot of estrogenic substance called bisphenol A, so it's not good. So we need to clarify it, see. But again, wild fish, certain fish are not high in omega-3s. Like a lot of your white fish are not so high in omega-3. So most of my patients need at least 500 milligrams of omega-3 a day. Some need 1,000. Some of my patients need 2, and some need 4,000.
So even if you do eat fish, you may need some extra.
Exactly right. But that's one of the key things. You've got, number one, we've got to get that sugar down. I put them on my Beyond Keto diet. I put them on this high polyphenol olive oil and oleocanthal olive oil. I put them on Super K, Super K2, and that starts to pull the plaque out, and omega-3. Those are the big things we do that reverses plaque.
We heard a lot about vitamin D. Is it still all true about that?
Vitamin D is still
the two sides on it.
Vitamin D is still, I believe, the most important vitamin. But what's happened due to COVID, everyone took massive amounts of vitamin D. Now most people's vitamin D, a lot of my patients, is too high. And so now they're getting kidney stones and other problems about too much vitamin D. So again, moderation is the key. I check the level on everyone that comes in to see me as a patient. I check their vitamin D level. It should be ideally 50 to 80 nanograms per deciliter. But again, many people, it's over 100 now. So you have to get your level checked and get on just a moderate dose so that you keep your levels in the normal range. It's real simple.
How about cancer now? There's people with cancer.
Oh my, cancer!
I'm hearing it
cancer
all
is
the
epidemic
time now, Doc.
Cancer is absolutely
like even younger people.
Oh, I know.
I'm in shock sometimes.
You know what? I just read an article today that came out of one of the universities in Europe. They found that people who get tattoos have a 21% higher risk of lymphoma cancer.
Oh, dear God.
That's something brand new, tattoos. We are seeing so much cancer.
You know, it's amazing because I've always told people the Bible forbids.
Yes, but now we know. That just came out today,
wow.
okay? Or this
So
just
what
a
do
day
they
or
do?
two.
Somebody
Well, number one, what you have to do
that
is,
has a tattoo.
Well, again, don't get any more and pray about getting it off, okay? Because there's now lasers that'll remove tattoos. But I'm telling you.
But I mean, does it happen when you do it or?
No, after time. For some reason, these people that get tattoos have a 21% greater risk of developing lymphoma of the lymph nodes, cancer. It's another type of cancer that's increasing exponentially in this country. But why are the reasons for cancer? It's real simple, Benny. It's our diet, it's our stress, it's our lifestyle. It's because we're not eating living food, we're eating dead food.
How does stress play part in that?
Well, when the body is stressed out, it weakens our immune system. When we don't get enough sleep, it weakens our immune system. Our natural killer cells are like the Navy SEALs in the military.
I read something a few days ago that was a little scary, that severe stress reduces life by like so much.
Oh, yeah.
So many hours.
Oh, for so many years. Okay.
Yeah, like you can reduce your life.
Oh, you can. Stress is a killer. Stress is a major killer.
Severe stress.
Yeah.
When I left the hospital, people, I was there in 2015 when I had my heart issues. Dr. Tian Song, who was brilliant with what he did to help me with my health and my heart. He said, I can help you with everything except I cannot help you with stress. He said, that's where you come in and control your stress.
Right.
He said, we doctors can't help you with that because, sometimes we allow that on in our lives and we don't know what to do. And he said, just get away. Just
That's right.
run.
And enjoy life. Enjoy
go somewhere
life.
where you don't have to even think about what you're going through.
Well, it's real simple. It's just stressful lifestyles, eating dead food, not even living food, not taking the nutrition, not exercising the body. When you exercise, you're detoxing your body, sweating. It's one of the best detox mechanisms ever, and it stimulates the immune system.
You're convicting me.
So exercise is critical. We got to exercise.
You too, huh? Okay.
Our body's made for movement. And the people...
Say that again. I like that.
Our body's made for movement. I just saw a lady, I'll tell you, this lady I just saw a couple of days ago in my office. I was checking her, and I have them take their shoes and socks off always. I feel their circulation. I said, your pulses are terrible. Are you not exercising? She was a lady in her mid-50s. She says, no, I quit exercising after Christmas. I just never got back into it. And I said, I can tell, your circulation's sluggish. And you know
but
what?
if you get back into it, it will help you. The body
exactly
heals itself quickly.
It will, exactly. Once you put the right fuel in. That's why I get people on the keto zone. Yeah. I get people eating the right olive oil, oleocanthal,
How do they
right
get
nutrition.
That book, The Keto Zone? By
Just, they can go to my website,
which is what?
drcolbert.com. Or
One more time.
drcolbert, COLBERT.com.
Okay. We'll put that on the screen for.
And again, they can also get it on Amazon or at most any major bookstore.
It's called Keto Zone.
Well, it's called Beyond Keto.
Oh, Beyond Keto.
Yeah, Beyond Keto. This is the Keto Zone diet, but Beyond Keto is my newest keto diet. Okay.
Doc, you're so smart.
Well, it's fun. I've been doing this for many, many years. I better learn something.
And one final question. How to have good vision? Is there anything people can do to keep their vision as they get older?
Well, can I tell you, the number one cause of loss of vision is sunlight. It causes cataracts. Wear sunglasses. And wear sunglasses that come all the way around that are polarized, and wear a little visor or a hat when you're outside. If you do that, you're protecting your eyes. And most doctors don't tell their patients.
Cataract comes with age, with everybody.
Yes,
really.
but it comes mainly with sunlight. Sunlight triggers cataracts. And we have great sunlight here in Florida. So because of the sunlight, it's causing cataracts to form prematurely in a lot of people. If they just wear sunglasses and a visor or a hat outside, they'll be fine.
And those vitamins that supposedly work with helping with your vision, do they really work?
There's certain ones for macular degeneration, like AREDS 2 or MacuGuard, and there's certain ones that do help with macular degeneration, but that's kind of rare. That is kind of rare.
I heard that B3 really helps. Is that true?
B3 is okay, but again, we have a few things that work really good, like spinach, lutein. Spinach is great. One of the best things.
With eyesight?
Spinach is great because it helps with eyesight and helps prevent macular degeneration. We also have an amazing supplement called nanoglutathione. And every cell in the body needs glutathione. It's the master antioxidant. And this is an antioxidant spray. You squirt 4 sprays in your mouth twice a day.
Okay.
And it's absorbed almost instantly. And literally, it's absorbed and goes to all the different cells in the body, help to restore the cells of the body. And it helps prevent many different problems from occurring.
He's so smart, isn't he? Don't you wish you could be smart like that with all this health stuff? Well, listen, make sure to get all the stuff.
Oh, now we have a podcast too. You can on my.
Please
we have a
them.
podcast. Just go to drcolbert.com, and we have a little podcast icon, and we're putting the how to clear every disease on this podcast. Every disease. We're going in the studios once a month, and we're taking every disease. We're breaking it down, showing people how to reverse them. One of the key things is the Beyond Keto diet or the Mediterranean. That's how we reverse it.
I've known him for 30 years or more.
No, 40. We've been 40.
40 years. Wow. He's the smartest doctor I know. And every preacher that I know looks to him for help. So make sure to look him up. Dr. Don Colbert. It's time to give to the Lord's work. Boy, this has been so wonderful. It's time to give to the Lord's work so God can bless you. I'm on my way overseas, in fact, this week. And then next month again, and the month after that.
Praise
So pray
God.
for me. I think I need some of that stuff to
Amen.
stay strong as I travel.
Yes.
So you can give on the platform you're watching me on, or just go to our website, bennyhinn.org. And we're just now releasing, finally, 12 languages daily around the world.
Awesome.
Yeah.
That's
so
awesome.
when I speak now,
Good.
my mouth moves with the language. I speak Russian and Arabic and Mandarin and Hindi. Oh, yeah.
Wow, I love it. I love it.
It's quite something. You see me talking. Anyways. You know, it's not a perfect technology, but it's at least it's a start.
That's
you know?
good. That's good. It's
So
needed.
thank you for helping us with that, huh?
Amen. It's needed.
Yeah. All right. Much love. I'll see you tomorrow for a powerful teaching. Bye-bye.